I've been feeling quite sickly, very tired that period of time. But I've just, brushed it off, thinking that it was probably just, having too many kids, doing too many things, at the same time. And but there was one day I felt really, really sick. I was very, very uncomfortable. So I drove my daughter to where she needed to be, and then I left and told her, "I'll be back for you." Then I didn't realize that I would not be able to come back for her because I went to the nearest polyclinic, okay, and found out that I was anemic. The doctor told me that I was at the risk of going into stroke. So immediately he told me, go A&E. So the first thing I thought, okay, Bukit Merah, where am I nearest to? SGH, okay, I have confidence in Singapore healthcare system, let's go. So I checked myself in to the A&E department, and true and behold, I was found to be anemic. And later on, when I found out that there was a growth in my womb, I thought, oh my goodness, could things get worse? What if it was cancer? So I admitted myself to A&E in the afternoon that day, and then by evening time, I knew what was the problem and I knew what was wrong. My father's an insurance agent, so I actually worked out with him right from the start when we were covered for health insurance that we wanted the best plan. So I actually told him, no, just give me the best one, all right? And so I make sure that I'm fully covered. So I know that I was eligible for private hospitals, and I was also eligible for restructured hospitals. Yeah. So that was the assurance that I had, which I felt was a real relief because I then, even though I chose to go to a public hospital, I knew that at the back of my mind, if I needed a second opinion or if I needed a different kind of treatment, I always had that assurance that I could always, switch to a private hospital. I don't remember me needing to do anything because everything was just e-filed. Yeah, all I had to do was to tell the counter staff that I have an insurance policy to cover me, and they said, okay, we'll just handle it from here. Him being an insurance agent, he knows that there is always that uncertainty that you have to be faced with, right? And he tells us to be prepared for those uncertainties. Yeah, and I think, because of his teaching, has been ingrained in us since young. So in fact, this is something that I also adhere to and I ascribe to. For our children, we teach the same thing, that we hope that we will never get to use it. I would say do it before you find out you've got a health condition. Go and get your coverage sorted out first. I think, with whatever budget you have, it's good to have things planned out in advance so that you will be prepared, and when you are really faced with the unfortunate event that you need to utilize this health policy, this hospitalization plan, then you know that you're already covered and you know who to reach out to, whether it's a public hospital or whether it's a private hospital. What are your options available? Yeah. I heard about the cancer changes in the cancer coverage and all that. I think that is something that I probably will have to review. But as of this point in time, I think because right now I'm still at the best plan that was available, I still feel quite confident that I will not have to burden my family.